So welcome back to another edition of the Heart to Heart podcast. And today is a little bit special because I actually have another Dr. Hart on the show. So my guest today is Dr. Carl Hart. He's the author of Drugs Use for Grown-Ups Chasing Liberty in the Land of Fear. And that's what we're mostly going to be discussing today. So Dr. Hart, welcome to the show.
Thank you for having me, Dr. Hart.
It's kind of funny to say that, hey?
Yeah, it's different.
So, I read your book from front to back, like I was saying, and, I thought it was incredible. There's a lot of things in there I think that have already kind of made me a better clinician, a better physician. So, I really appreciate you writing it. But, before we get into the book, and of course, that's what we're going to talk about today. But, Shikari Richardson, that's been on my mind too. I've noticed that you've, posted about it a couple times, like, what do you make of this whole situation?
Obviously, I think it's tragic because the Olympics only comes around every 4 years, in this case, fifth year. And so I don't know how she will fare in the intervening 3 years to the next Olympics. And so if she missed her only opportunity because of a marijuana positive urine test, I think that's tragic. And I think that the rules should be changed, and we'll see if they actually do it.
Yeah, I agree with you, 100%. I think it's ridiculous that she's being punished for using, THC. And like you said, like, yeah, she's 21 years old. She might have another shot, but she might not. Like a lot of female athletes, have very, very short-lived careers. They're not as usually as long as male careers for whatever reason. So like, you're right, this might be her only shot. And very last question on this before we get into the book, because this is the thing that people are asking. I mean, I think I know what your answer is going to be, but do you think that cannabis is a performance enhancing drug?
Cannabis is about as performance enhancing as something like alcohol. Alcohol is an anxiolytic, and anxiolytics sometimes can help improve performance on some task or what have you. And so, if you're going to say that cannabis is a performance enhancing drug, then you have to say alcohol is too. And we are not prepared to do that. And so we shouldn't be prepared to say that cannabis is a performing enhancing drug.
Yeah, I agree with you. Like, I don't think that it, enhances performance. Like a lot of people say, it can help with sleep, it can help with recovery and that type of thing. But I mean, you could say that about anything. Then you're going to say that, well, melatonin helps people sleep better at night and makes them more rested. So that helps with recovery. So yeah, I just wanted to know, your thoughts on that before we got into the book, just because it's such a hot topic and it's very, near and dear to me, considering I, kind of consider myself a cannabis physician of sorts. But getting back to your book, and for people who are watching this on video, here's the book here. It's a great book. I enjoyed actually every single chapter in it. But there's one chapter I think, or many chapters really that stood out. But one that I emailed Carl about the other day was chapter 8, and I think that I'm kind of guilty of this. So I have been a big advocate of decriminalizing all drugs, but I have definitely, been more of an advocate of decriminalizing psychedelics. And, that's something that I think that a lot of people in the psychedelic community are guilty of. And you address that in that chapter. And I was just, wondering like what really like prompted you to write that particular chapter, and what's been some of the response maybe from some of the psychedelic snots, so to speak.
Yeah, the thing that prompted me to write the chapter is it's just a bit annoying to see people take their drug and treat it as if it's somehow special, or that there is some exception that should be applied to their drug that's not applied to other drugs. And it's not fair. It's disturbing to me that we don't think about the folks who are catching hell. And so whether we're talking about somebody's sexual preference or somebody's drugs, it's exactly the same thing. You don't vilify people or elevate yourself or what your activity is over their activity, as long as they're not bothering anyone else, long as they're not preventing anybody from enjoying their activity. Why are we treating their activity less than our own? It's the same sort of line of thinking that got us into vilifying people who have a different sexual preference, vilifying people who may be a different race. It's the same kind of thinking. And so that's why it disturbed me. There are people who are in the psychedelic community, which I am a member of in myself, who may not like that. They may, because they think that on the one hand, their heart's in the right place. They think that saying that people should have the right to take methamphetamine or have the right to take heroin, who are just by simply saying that somehow I am disrupting or causing a problem for the mission to legalize or decriminalize psychedelics. And it's like, I'm not a politician and I don't really care about people's sort of strategies to legalize or make these things more available if that strategy means that you somehow leave out other people. So I don't have the right to sell out other people's right as some people are comfortable doing. I am not.
Yeah, and I think that's a really good point. And again, like, I've been guilty of this, and a lot of, physicians and people I know have been guilty of this, of, saying that, we need to legalize just psychedelic drugs. A lot of people have said that, and we should leave, everything else alone. And I've also been guilty of saying that, stimulants and opioids, and benzodiazepines, should almost never be used, which is, absolutely wrong as well. And I understand that, maybe there's some people who, they microdose, or maybe they macrodose, and they have these, amazing, life altering effects, and that's wonderful. But, there may also be some people, like yourself, obviously, who use other substances, whether it's stimulants, whether the opioids, who get the same effect and also have the same amount of responsibility. And they also are able to manage their lives very well. So yeah, there's lots of people out there who are, microdosing with psilocybin, LSD. I think those ones are the, two most common ones anyway, for microdosing. But there's lots of people who are probably also using, small amounts of stimulants and small amounts of opioids, who are getting the exact same effect or the exact same results, and they're also being responsible adults, meaning that, they're still attending their job, they're still, wonderful, husbands, fathers, mothers, whatever it is, while using these drugs. So, I agree with you that we shouldn't be, demonizing someone for their drug of choice, just like, we're much better at not demonizing people for whatever their sexual preference is. So, I think that's a really important chapter for, like, a lot of people to read. And, like, I'm certainly, trying to share your book with, a few of my colleagues who I would now consider to be psychedelic snots, or I think you use the term psychonauts in your book. Um, but I knew exactly what what you were trying to say when I was reading it. So again, really do appreciate that chapter. Um, Another
Yeah,
thing. Sorry, go ahead.
I just have to say, I love a lot of people in the community, psychedelic community, and it's like talking to family members. It's like it's with love, and we have to be better. So I hope people take it as such.
Yeah, I hope they do too. And I hope that, I mean, psychedelics is supposed to be all about empathy. So, be empathetic towards people who are using, different drugs than you're using, and I think that's, a good message for some of the psychonauts, so to speak. Um, but also too, I chapter 10, you chat a lot about, or it's all about opioids for the most part. And one thing that I noticed in there was, you didn't mention kratom, and I know that kratom has come up a lot recently. And maybe it was just like, it's a pretty big book as it is, and you probably couldn't cover everything that you want to cover. But just wondering like what your thoughts are on that particular substance.
Oh, that's a great point. I use kratom on a regular basis in the U.S. because um, it's difficult to get opioids, other opioids, and so kratom has been my sort of go-to substance. And so I'm a fan of kratom. I use kratom tea, the powders, and so forth. And yeah, my sort of not talking about kratom was in part because I didn't, I didn't have as much research on kratom, and so I didn't want to send the wrong message to people when I'm talking about this drug, as if it's okay to use it when I did not have all of the research that I would have liked to have, like I have on some of these other drugs. But personally, I am a user of kratom.
Okay, excellent. And like if people, a lot of people listening to this probably don't know like what kratom is. Is there any way you can give us a little bit of background on kratom and maybe compare it to other opioids?
Yeah, so kratom is it's a plant-based compound that is sold legally in our countries, tea products or powder. The thing is that it's an opioid, but it doesn't seem to stimulate the opioid receptor to the same extent, the mu receptor certainly to the same extent as something like heroin or something like oxycodone. And so you can push the dose and you don't get that same sort of stimulation of the mu receptor. At least I haven't had that experience myself. And so sometimes if you were an avid lover of opioids and you push the dose, you might get some of the negative side effects. Like, I don't know, some people have reported getting a rash after using large amounts over extended periods of time. And so I don't know enough about it yet in order to even evaluate the veracity of that claim. But I do know that you can push the dose and you still won't get up to the mu sort of stimulation as you would with something like heroin.
Okay, so and then based upon the fact that there's going to be less stimulation at the mu receptor, would it be reasonable then to conclude that we'd be less likely to experience withdrawal effects when using it?
Uh, Maybe you might be less likely to experience withdrawal effects, but I don't think withdrawal is a major problem with people who are taking these things just recreationally, and you're not really even with something like heroin. You can take heroin for some extended period of time, as long as you don't push the dose. You don't really have to worry about withdrawal. Heroin is a short acting opioid. It's not like the longer acting opioids where you have more of a problem with that issue. So with kratom, I certainly haven't experienced any withdrawal, and I use it on a relatively regular basis, and I stop without any sort of problem.
Excellent. And for people who aren't aware, and again, I'm still learning about kratom as well, but unlike some of the other opioids, or I guess all the other opioids, kratom has different strains. So just like cannabis has different strains, kratom has different strains. So you can get a strain that's more uplifting, and those tend to be more of the white Borneo strains, I believe, and then the strains that are more sedating are more of the red Borneo strains. And do you feel that like, have you noticed a difference? I'm not sure if you've used both, but have you noticed a difference between white Borneo and red Borneo, and that they are different, or do you feel that the strains are kind of all the same?
I I have tried a wide range of strains, and I can't tell the difference. And I have a few former students who own a kratom company, Top Tree, and they would be embarrassed that I don't know the difference. I don't know the difference. I haven't been able to feel the difference, and so please, guys, forgive me for not knowing or feeling the difference. I haven't experienced a difference.
Okay, got you. Yeah, that's just a lot of questions. A lot of my patients have even asked me about kratom before, and I haven't seen too much in the literature about it. So just appreciate all of your insights on that. But one thing too, coming back to opioids, and a really good point that you made in the book was Percocet. I don't think a lot of people realize that it is combined with acetaminophen, and which is Tylenol, and which is very liver toxic. So I wonder how much of the problem from Percocet specifically is actually attributed to the Tylenol and not to the opioid itself. And that's something that you discussed in your book at length. So I mean, why don't we have Percocet available without acetaminophen?
That's a good question. This is the question I've been asking for a number of years, at least 7 to 10 years. I've been asking that question. I can't get a good answer. Um, I suspect we got acetaminophen put in with oxycodone, so some pharmaceutical company could have a patent on that formulation. And the question for me today is, why do we have acetaminophen in with these other opioids like hydrocodone or even oxycodone? It doesn't make any sense. If you want your patients to be on both of them, you can simply ask the patients to take these individual drugs. But people who are seeking an opioid-like high and they are using something like oxycodone or Percocet with acetaminophen, they run the risk of blowing out their liver. And we don't have any major educational campaigns that tell people to avoid this and what opioids to seek, as opposed to those ones that contain acetaminophen.
Yeah, I think that's, a real big problem. And it's something that, like I said previously, like I don't even think a lot of people who take Percocet even realize that, like it says 325 on the on the drug, but I think a lot of people don't even know what the 325 is, which is, unfortunately really, really sad, right? And coming back to the chapter again on opioids, there's a lot of deaths that have been reported, over the last few years. Like you mentioned, Heath Ledger, Prince, there's a few other people. And it's always seems like the blame is all on opioids, but that's not necessarily correct. What it appears to be is that these people are, taking several drugs at once, and they all seem to have fairly sedating effects. And then because of the combination of the drugs, that's why they're succumbing. It's not necessarily the opioids itself. Is that
Yeah,
what you see?
yeah, that's right. In the book, I tried to explain, at least in the US, when we think about who is doing these death investigations, it's primarily coroners. And coroners, the level of education that coroners have is a high school diploma typically. And in some places like California, the majority of the coroners are sheriffs, law enforcement. And so a number of these people are just not qualified to be doing death investigation. So when they are counting opioid related deaths, I don't trust the deaths. I don't trust their information, in part because they don't always have biological confirmation that an opioid was in fact on board when the person died. And even when they have biological confirmation, there are multiple drugs involved, and you can't tell which was the causal agent, which agent caused the death. And we don't seem to be bothered or troubled by the fact that we don't know. Instead, media outlets and a number of people in our country just are happy to say that this is an opioid death and this is part of the opioid crisis. Now, opioids, therefore, are vilified. And what is happening is that there are a number of people in North America who cannot get opioid-based pain medications because of this sort of hysteria about the opioid crisis. And that's no disrespect to people who may have died from an opioid related death. What I'm trying to ask people to do is to really figure out the reasons why people are dying. Once we do that, then we can go about making sure that other people don't die. But we don't seem to be interested in digging deeper to find out why people are dying.
Yeah, it seems like it's just so easy to blame it on opioids. You see like the corners you said that have, very low levels of education. It's so easy for them to say, I see opioids here, so that's, easily the cause of death. And then they may fail to mention that they also have, benzodiazepines, antihistamines, and other, medicines on board that are also, causing the respiratory depression. So I think that's a really good point, and something that I and certainly have probably been guilty of in the past as well. Like reading some type of headline that like, oh, Prince died from opioids, and then kind of believing it. And it's so easy to believe those things, and that's the problem. Is like people, and in many ways, in the coroner's instance, they probably just don't want to dig in and do the real work, because it's so easy for them to just blame it on, opioids, and people just accept it. They get to keep their job and they go on, So I imagine that's what's happening, a lot of times when these coroners are doing their job. It's just so easy to just blame it on opioids. That's what was in his system.
That's the problem. This is precisely the problem, and that would be okay if there were no consequences, negative consequences to that behavior. But there are people suffering who are chronic pain sufferers who can't get their medications because of this hysteria. And we are moving towards a place in our society where we're trying to make sure that we don't use opioids anymore in medicine. That's
Yeah.
the craziest shit I've ever heard.
Yeah.
Opioids have been around for centuries for a reason. But we're talking about moving away from opioids. It's like the world has gone mad.
Yeah, I agree. Like we have to use, opioids when they're appropriate, and you have to use benzodiazepines when they're appropriate too. And some people might be surprised. I mean, I have at least one patient that I have on opioids all the time. I mean, she's in her 80s. Her back is like a question mark. Like she needs these medications in order to literally to survive. And then some people will say that I shouldn't be like every now and then, or I mean, probably most commonly, when I prescribe benzodiazepines, it's just, two pills when people want to go on an airplane. And a lot of people have a lot of trouble, doing that. And even some of my colleagues say that, I shouldn't be doing that. I shouldn't be, prescribing that. But I mean, if someone's, not going to go on a trip because they're afraid to get on a plane, and if you can give them a substance that's going to calm them down, so they can get through, even if it's just a 2 or 3 hour plane ride. I mean, how is that not good medicine? And how is that not, making that person's life so much better? I mean, it could have been, a big meeting or something that like makes and breaks their career, So I think that we do need to, be careful about saying like all or none. These medicines are effective when they're used in the right context.
Yeah, I just don't understand it. Even we're having this conversation in the context of medicine. Frankly, I don't think the physician should be control of these in the only ones in control of these substances, to be honest with you. I know I don't want to go to a physician on a Saturday night and saying, yo, can I get a prescription for alcohol because I want to enjoy myself? I mean, that's fucking ridiculous. I mean, but that's what we're talking about when we're talking about opioids or cocaine or any of these drugs. These drugs can be used and can and have been used safely throughout human history. But now we have all of these different controls, in part because of various professions wanting to have control. I mean, we can easily teach people how to use these substances safely if we have knowledge about making sure that they don't have adulterates and they have the actual compound and the dose. This is not complicated. This is really simple. I mean, I give thousands of doses of these drugs to people in a laboratory on a regular basis every year. This is not that complicated, but we are pretending that it's so complicated in part because people's expertise are dependent upon them keeping this little knowledge for themselves.
Yeah, and that's a narrative we definitely like. I hate to go back to medicine again, but that's definitely a narrative we need to get away from medicine. It's like you're not an amazing doctor because you didn't prescribe any stimulants, benzodiazepines, or opioids. Like there may have been instances where you should have prescribed those medicines and they would have been better. But yeah, coming back to your point, I mean, the government is really treating us like we're infants. I mean, they're telling us what we can and can't put into our bodies, which is absolutely ridiculous. And also, like you said, most people who use drugs, they don't get addicted to them. So, it's not necessarily the drug itself. I mean, a lot of this comes down to, psychosocial issues. There's a big difference between someone who wants to have, a fun night on a Friday or Saturday night versus someone who's, living at the bottom. They're in the worst of the worst places, and they're using the substances just to basically survive. I mean, of course you're going to get addicted to it then, because you don't have a good life, right? And if that's the only thing that's going to make you feel better, then you're going to get addicted to it. But that's not the way most people are using the medicine. Like, most people are using the medicines just to have a good time, to make themselves feel better, to have a good time with their spouse, whoever it is that they're enjoying it with. And that can definitely be done responsibly. And we've taken that, liberty, as you say in your book, away from, all of the people.
Yeah, that's what the book is really about. It's for grown-ups, as I said, people who are trying to live their life in a way that you are not bothering other people. In fact, you're trying to be more loving to other people, and you're trying to make sure that people are taken care of in your society. That's what the book is about. It's about love. But when we talk about drugs, we're always forced to deal with these ridiculous arguments about what about those who get addicted, as if addiction has anything to do with drugs themselves, when in fact they really have little to do with drugs. They have almost everything to do with those psychosocial conditions. They have almost everything to do with people's sort of ability to support their families, to make a living. It has to do with all of these other sort of issues that we don't really want to address in a society. And if we don't want to address those issues, we can just blame drugs. And that's what we do. And so you make people like me, who's trying to help people to live better lives in which they take care of other folks, and we look after people in our societies, then you make me be defensive about saying that adults should be able to enjoy adult activities.
Yeah, it's completely ridiculous that we're in this position that we're in, where we have to beg and plead to use substances that we want to use, that are really just, for the most part, when you're doing it responsibly, makes your life better. It doesn't make it worse. And I mean, during the lockdown, they kept the liquor store open here, of course, right? So people could go get alcohol, but they still couldn't get all of these other drugs that may have been their drug of choice, and may have been much more beneficial for them in the long term and in the short term.
Yeah, I am happy for people whose primary drug is alcohol. They enjoy alcohol. That's fine. They're doing it responsibly. More power to them. Some of us have learned some things about drugs, and for me, alcohol is doesn't do what I need to do, and I think there are healthier ways for me to alter my consciousness than alcohol. No disrespect to alcohol drinkers, but I've learned some things about drugs, and where alcohol is just not at the top of that list. Instead, now knowing all that I know about drugs, I'm subjected to the whims of people who know less about drugs than me in terms of what I can have and what I can't have. That doesn't
Yeah.
make any sense to me.
And for me, as well, like personally, like alcohol is something that I can enjoy, but I don't like getting like drunk. Like, a couple glasses and a buzz is fine, but after that I just don't enjoy it. I like the medicines, the drugs that make me feel much more empathetic, and in particularly, MDMA is great for that. And, one thing that I think would, we probably have half the divorce rate if people would actually, if couples would take MDMA together by themselves. Like, sure, I'm sure there's lots of, there's probably even studies out there that indicate that doing it with a psychotherapist or, a counselor or whatever would be helpful. But I think that, man, if you get, your spouse, your lover, just the two of you together on a quiet day, you don't do anything else but MDMA, you can resolve a lot of problems, and very, very quickly, and a lot of people miss out on that.
Man, this is what we should be talking about. Absolutely. I am in absolute agreement with what you just said about MDMA. I couldn't have said it any better myself. MDMA, for couples in their intimate settings, and not with the under the influence or some other person. I certainly don't understand that as much. Maybe for some people you need a guide, but many of us adults, we much rather just have our loved one with us, and we deal with our issues in private ourselves. MDMA, an outstanding drug to enhance openness, empathy, forgiveness, all those things that we consider pro-social, things that we value. Yeah, so I don't understand how we manage to vilify that drug in this society, in our society. It's amazing to me.
Yeah, I mean, it's something that really, it just makes you feel like love, and it makes you feel so much empathy. And like I said too, I mean, I think it would just help so many people in their marriages because you're just not going to get the same feeling from alcohol. Like, alcohol may, reduce some of your inhibitions, but it's not going to, give you this empathetic feeling where you can really work on like a lot of, deep rooted issues, so to speak. So yeah, I mean, that's something that, I wish everyone kind of had the chance to kind of do. But on that point, set and setting, because like you just said, I mean, I wouldn't want to, go to an office with my girlfriend and take MDMA. I'd rather just do it at my home. And I think that most people would get, a lot more beneficial effects by doing it in their home, somewhere where they're comfortable, they know the environment, and in some, concrete building where, they're going to just be, flooded into the world after, so to speak, after the session is over. And they've taken that away from us. But that's why it's so important to have the right set and setting, because there's some people who may take that drug, say with a psychotherapist, and have a terrible time because they may still feel like they're being treated like an infant because they need someone to help them. Whereas, you could take that drug at home by yourself, or with your wife or your husband, and you could feel that you just had an amazing time. So a completely different experience. So, I really, think that people need to understand that set and setting is absolutely critical when you're taking these substances.
Yeah, I absolutely agree with you. One of the things, though, is when you think about all of the misinformation that we've had in our societies about drugs, MDMA included, there may be people who benefit from having a therapist, a guide, help them work through some of the nonsense and to dispel some of the myths, and then they trust that person in that setting, so they don't get paranoid or what have you based on all of the misinformation they've been told. So at some level, maybe for some people, it's important to have that guide help them walk through, and to help them to identify what some of these effects are. But that has more to do with the misinformation that we have for so long put out in our societies. And so I don't want to completely disregard those people who benefit from having a guide, even though I personally don't want to have such a thing, but I want to make sure that people have that option if they so desire.
Yeah, and that's that's one thing I try to do at my clinic. I'm not sure if you're aware of this, but I prescribe ketamine, and I have take people who take it as a monotherapy, and I've been published for that work. And I also too have people who take it under the supervision of a psychotherapist, and I'm actually being published for that work as well. Hopefully, it comes out in about a month or so. So I think that there's benefits to both, and for people who are maybe a little bit less anxious, they can maybe get away with doing it on their own. But there's some people who they're very, very anxious about doing it, and they may in fact have a very poor experience if they did it on their own. They may not feel like, once you start to feel a change, and I mean that's what these drugs are going to do, they are going to make you feel different. They get freaked out, because even though they want to feel different than they do, they're very, very depressed and anxious. um, just the thought of any change makes them even more anxious, even though they know that they need change. So for those people, and for people too, some people have a very special relationship with the psychotherapist. So the first time they want to do this, they want to do it on their own. And then there's people who might do it a couple times with a therapist, and then after they feel that, okay, I can do this on my own. So I think that both have very therapeutic experiences in them.
Yes, absolutely.
One thing too that I wanted to ask you about, in your book, because it's all about pursuing, or using, any drug that you feel could make you happy in some ways. Well, I'm kind of simplifying that. Is like performance enhancing drugs. So some people do use things like testosterone, human growth hormone, to make themselves feel better. I'm just wondering what your thoughts are on that.
Yeah, it would be nice if we had some direction for those people. As you know, there was a time in medicine where we said that those type of hormones like testosterone, exogenous testosterone, really was not beneficial. It didn't have any performance improvement. Well, that wasn't true. People pushed the dose, and they got those sort of improvements that they were seeking, whether it's physical, just attractiveness, or whether it's actually performance. So it would be nice if we had better guidance in terms of the dose range, to make sure that people are not getting into dose ranges that would cause them problems, whether it's physical problems in the immediate time or long-term time. It would be nice to know that, because hormone replacement therapy basically is what people are doing, trying to, if your testosterone levels are not as high as they once were, you take some exogenous testosterone to increase it. You're just basically trying to have hormone replacement. That seems like a good idea, a simple idea. We need to know, like, what are the real drawbacks versus what are those exaggerated drawbacks, and then provide guidance for people who are going to engage in that behavior. We haven't done it in that area, just like we haven't done it in psychoactive with psychoactive drugs. And so, as long as we don't provide that guidance, people will continue to do it illicitly, and they know, turns out they know, many of them know a lot more than what we know in medicine, because they push those doses, and we are just unaware of it.
Yeah, I think that, unfortunately, some of those, medicines, particularly testosterone and human growth hormone, like those are the only ones that I prescribe at my clinic, have kind of been demonized a little bit. Although I do feel that, people are definitely more open to it now than say they were 10 or 20 years ago. Just because, low testosterone is associated not just with like low motivation and low energy and depression, which is, kind of what we're talking about today, but it's also associated with like increased risk of cardiovascular events and increased risk of diabetes and metabolic disorders. So I know that question was maybe a little bit, um,
Oh, but that's a good. That's. I'm glad you raised it because I wasn't aware of that, and I'm glad that you brought it up. It's right in line with what we're talking about.
well, and I just feel that too, like for whatever reason, like women are fine to say that they're on hormone replacement therapy. Like if a woman says it to another woman, maybe not 100% of the time, but most of the time, they're not, you know, met with that much resistance. But if a guy says that, he's taking TRT, it's like he's met with a ton of resistance, and it's like, oh, you need to know that. And it's almost like some shame in it. Like having low testosterone is like shameful. It's like if you have low testosterone and you know that by replacing it safely under the guidance of a doctor by doing blood tests, like why would you not want to do that? It's a very, very odd thing that I find that is a big difference between men and women. you know
Well, I'm glad you're doing that. I'm glad you are talking about it. Educate the rest of us because it's right in line what we do with psychoactive drugs as well. So I'm glad to hear that.
and then also too, the one real big thing in the book that I just can't believe that we don't have this implemented in North America at all is the safe drug testing. I mean, that seems to be something that is just an absolute no-brainer. So what I mean is, Carl really explains in his book, well, there's several countries that where you can take the drugs that you have and to a center and they can test for them. And we know, as you pointed out in your book, that a lot of people who are dying from opioids are dying from things that are laced. They're laced with fentanyl, they're laced with other drugs. So, why hasn't this been implemented in North America, do you feel?
I think it hasn't been implemented. Well, let's just be clear. There are places like Austria, Spain, the Netherlands, Colombia that it has been implemented in, but it hasn't been implemented in North America. I think in part because the same reasons we were reluctant to give out condoms before. I mean, in the 1980s when we were experiencing the AIDS crises. We said that, well, you hand out condoms, you're encouraging sex, sexual behavior before marriage. Silly things like that, we said. So I think in this case, people are saying something similar. If you have these facilities, then you're encouraging drug use. It's ridiculous. But I think that's one of the main reasons we don't have it.
Okay. Yeah, I think it's probably one of the, I mean, that makes perfect sense. One of the main reasons why we don't have it. People think it'll encourage them to use drugs, but from the data that you've pointed out in the book, like that's not the case at all, correct?
No, it's not the case, but let's just say we don't say that anymore with condoms. We're okay with handing out condoms because what we care about first is keeping people safe. People will engage in premarital sexual behavior. The societies don't want to encourage that, but it's more important to make sure that if they do, that they're safe. So when we think about drug use, when we think about making available drug checking facilities and saying that, well, it might increase drug use, frankly, that's not that important. The important thing is that you keep people safe because what's happening now, people are dying from not knowing what's in their substance. They're dying from tainted substances. You make sure people live to fight another day first. And then you can figure out, you can talk to them about taking drugs or not taking drugs or how to do it much safely or what have you. But if they're not here, it doesn't really matter. And that's what's happening when you don't have these facilities. People are subjected to getting adulterated drug and possibly harming themselves.
Yeah, it seems like an absolute no-brainer that should be, implemented immediately. And just another statistic that you had in your book here too. Since Portugal decriminalized all drugs, I think you reported that they decreased the heroin users there from about 100,000 to 25,000. which
Yes.
seems to be, an incredible decrease. So again, that's exactly what we were, just talking about a second ago, is that, there's this perception that like if you make something, legal, then, more people are going to use it because it's going to be more accessible, or decriminalized in this case. And when you look at an example of like Portugal, they have done their decriminalization, and that hypothesis that if you decriminalize drugs and make it more accessible and less lenient on incarceration, all that type of stuff, then people are going to use more. But in fact, it's the direct opposite, and it's quite the opposite. I mean, 100,000 to 25,000. I mean, that's drastic, right? I mean, it's 1/4 of the people who are using the drug before because of this new policy.
Yeah, and so people say, how can that happen? One of the things that happened too with Portugal is that they destigmatized the drug use, and so that made it easier for people to say who needed help actually to come and receive help, and also it made it easier for people to come out of the shadows who were using in a way that might not have been problematic, but then it progresses to being problematic because you're using in the shadows and you don't have these sort of support organizations that are now allowed to be out of the shadows and into the public. And it's not something that you should be embarrassed to do. And so I think that's one of the reasons that they saw a decrease. But the most important thing for me about that Portugal data is that when we look at overdose deaths in Portugal, when you take they had about 6 deaths per 100,000 residents. In the United States at the time, we had more than 300 deaths per 100,000 residents, whereas they had decriminalized the drug and we continue with our prohibition policies, that we were saying that we were banning the drug. So we banned the drug. The drug is, they have more liberalized drug policy there, and they have far fewer deaths. And these are rates, so you can compare the populations. So you're talking about 6 versus more than 300 per 100,000 residents. That's powerful to me. In Portugal, they have drug checking facilities as well. And I think that's one of the main reasons that they don't have these deaths, because drug use is not stigmatized like it is in places that have these prohibitory policies.
Yeah, and with less stigmatization, you put more of the responsibility on the user, and I mean that's what we should be doing. So we should have adults have more responsibility to take care of themselves, like not even just with drugs, with everything, with how they eat, with how they exercise. But it seems like none of this is ever discussed, and what people like to do is they like to blame things. And one thing that I noticed in your book, I've mentioned a couple people before, like a lot of your book is about responsibility. And ironically, like I was reading Jordan Peterson's new book at the same time, and there was a lot of, and people may not think that there are parallels between the books, but I thought there was a ton. And I feel that like that's the thing that we need to address, is that adults can be responsible, and we need to make sure that adults have the ability to be responsible. And when you're just treating us like infants, then you're going to have poor results. But if you don't treat us like infants like they do in Portugal, and you destigmatize things, people are going to be more likely to take responsibility when they use these drugs.
Yeah, it's unfortunate that, on the one hand, I'm really happy that we have a lot of different media outlets where more people have voices. I'm really happy. But that means that when you have this large number of outlets, everybody is vying for your attention. And one way that you get people's attention is that you do more outrageous things and you pit people against people in these outrageous ways. And so we can't see the sort of common ground that we have. We can't see that because this person was on this podcast, or this person who was on the right podcast, and this person was on the left on somebody else's podcast, they must not agree. It's not true. Like many of these ideas are fundamental to us being able to live our lives as we see fit, as long as we're not bothering other people and trying to make our societies better, to make sure that we're able to help support people who are having problems in those society. I mean, it's very simple. It's very simple to me. My job is to try and be the best citizen I can, and that means helping other people who are having problems in some cases, because those same people will be people who turn around and help folks who, when I can't help folks. I know I was one of those people who needed help, and people helped me, and so I feel like it's my responsibility to do the same thing for them. But it's also my responsibility to allow people to live their life as they see fit, as long as they're not preventing others from doing the same.
Yeah, and I think that's really important message. We can't be, telling people what they can and can't do. And education is really, the answer to all this, and giving people their responsibility back. I think that's what we need to kind of say to people. One thing too, I know we only have a few minutes left, and I know you really want to watch that England soccer game coming on, but dependence versus addiction. I think you touched on it a little bit in your book, for sure. And some people sort of have different opinions about this. So they'll say that someone who uses opioids from the street, and when they with withdrawal, that they're addicted. But say someone who sees, not that I really prescribe antidepressants very much, but someone who sees a doctor for antidepressants, and then they go away for a weekend and they forget their antidepressants, they're experiencing very similar effects. I mean, they might not be the exact same from the exact same drug, but they're like still, like, their weekend is ruined. They don't feel good. I was just kind of wondering how you feel about that dependency versus addiction argument.
Yeah, so the dependency that you're talking about is just physical dependency, and it's not a big deal. It happens with things like even caffeine. If you've been
Sure.
doing a drug for some extended period of time, and then you abruptly discontinue, you might have physiological symptoms that are disruptive, or that are not pleasant. They may not be life-threatening, but they may be unpleasant, and that's called physiological dependence. And it's nothing wrong with that. It's just part of pharmacology. The body grew accustomed to having a drug on board, and the body had compensatory mechanisms to try to make sure everything else is functioning well. And part of those compensatory mechanisms, when the drug is not there, then it seems as though there's an overreaction because of those compensatory mechanisms. That's just a normal biological sort of function. Nothing wrong with that. Whereas addiction is where we have psychosocial disruptions as a result of your drug use. That's one component. And then the second component of that is that you, the user, are disturbed. You're troubled by, or you're distressed by these disruptions. And that's addiction. That's how we define addiction according to the DSM, according to the International Classification of Disorders. That's the medical definition of addiction.
Okay. Yeah, that's a really good answer. I really want to ask that because there's so many different, opinions on that particular subject. So thanks so much for answering. Dr. Hart, we're basically all it's so funny saying that, but Dr. Hart, we're basically all out of time here now. Is there anything that you wanted to mention or leave with the viewers?
No, this is the first time that I talked to another Dr. Hart, so it's a special podcast for me. So mad props to you, Dr. Hart, my brother Mike. So thank you very much. They don't know that we have the same relatives. I guess we won't tell them this episode. We'll tell them another episode.
That sounds great. And if you haven't done so yet, pick up Dr. Hart's book. For everyone watching on video, I got it pulled up here. And where can people find you, Dr. Hart? Before
I'm on Twitter, Dr. Carl Hart. That's Dr. Carl Hart, and the website is the same address. So please read the book and check out the book, and please understand that I'm tired of answering silly questions, and I just want to be an adult. And if you read the book, you'll understand that. And so please understand my sort of tiredness of dealing with silly questions. But I don't mean you personally asking silly questions, but a number of people in the media have asked me silly questions.
Well, thanks so much again for doing this. It's been an absolute pleasure talking to you. Thanks so much for writing your book. I really enjoyed reading it, and I'll definitely be, referencing that for years to come. So thanks again for coming on.
Thank you, my brother Mike, my brother Dr. Hart. I will see you soon.